Good afternoon, everybody. I'm Christine Barconi in the NBC4i Streaming Center. Right now, we want to talk one-on-one with Governor Mike DeWine. Governor, thank you for joining us this
Good to be with you.
afternoon. Another 4,000 cases today, second highest number that we have seen since the beginning of the pandemic back in March. 55 deaths, that number above the 21-day average, and 180 some hospitalizations, all three above the 21-day average. How do you expect the COVID-19 trajectory to change if it's being proven that people's behavior is not changing?
Well, I think we're starting to see some change. I think as this virus really hits the rural areas, people are now starting to know someone who's had it or has it, seeing the tragedy of death. And I think that it's starting to come home to people, but we've got to pick our pace up. We've got to get 95% mask compliance, every store in the state of Ohio. We've got to get people when they make personal decisions about what they do, they just have to be careful. They can continue to do all the things or most of the things that they like to do, but they've got to do them differently. And part of the difference is do it with a mask. These masks really work. We're seeing it in our schools. We're not seeing much spread in our schools. We're not seeing spread really in the classroom itself. And the reason is because everybody is wearing a mask. So it works. So to get back to the original part of your question, we're not going to see a change until, we see better mask compliance and people being very, very careful, in social situations or personal situations where, they've been letting their guard down. And that's what's going to take.
What's the status of filling the health director position? And do you think that not being filled, the state not having a doctor or a health director to look to, do you think it's hindering the efforts to slow the spread?
No, I don't think it's hindering. We have pulled in some amazing people from Ohio State, from UC Health, from the Cleveland Clinic, UH Hospital in Cleveland, people all across the state of Ohio who we used for advice. We get on calls with them. They've done a great job. In addition to that, we have pulled people in, frankly, from our cabinet who are running other departments who for the last number of months have been actively engaged in rolling up their sleeves and making things happen in the health department as we battle the pandemic. So we've not been hurt by that, but we are working very, very hard on getting a new director, and we hope to have something soon on that.
You mentioned last week, I believe it was, that most of the new cases are coming from informal gatherings as well as large parties like weddings and funerals and different things like that. Is that still the case? What's the health data been showing has caused the biggest spike in COVID cases over these past 2 weeks?
There's really widespread, what they call community spread. Many times people don't even know where they get it now. But when they do know where they get it, a lot of times we'll find out that it is just a personal party, a bachelor party, a wedding, people getting together to watch football. I mean, just, things where if they'd worn a mask, if they'd kept some distance, they would have still been able to do that event or that fun thing that they wanted to do, but they weren't wearing a mask. And that's a problem.
So in situations where masks are mandated, such as being at bars and restaurants, and there is mandated social distancing, or you face a fine or whatever it is, taking that into consideration and how these parties and informal gatherings where there is no, formal rules in place, taking that into consideration, would you consider lifting the restrictions on bars and restaurants anytime soon?
No, I don't think you can lift those restrictions. And we don't have many restrictions. We have a 10 o'clock cutoff of alcohol. And I know that's been tough on the bars and tough on the restaurants. But, we've seen cases go up from 1,000 a day 4 weeks ago to 4,000. So this is not the time when we should be, lifting those restrictions. It would not make any sense to do it. Most of the mayors in the state of Ohio who deal with this in their city every night are adamant when they tell me, don't do it.
Whenever you saw that 4,200 number yesterday, what was your initial reaction?
Well, it just gets worse every day. I mean, not every day, but we're just seeing it spike out of control. So people should be concerned about that number. They also should be concerned, as I am, about what we call the positivity number. 4 weeks ago, we were at 2.5%, which means 2.5% of the cases of all the tests that's done that day turned out to be positive. Today, we're pushing 8-9%, and that's just in 4 weeks. So you're just seeing it go up. So anyone who thinks that the only reason these cases are going up is because we're doing more testing, simply not true. We are doing some more testing, but we're certainly not doing 4 times as much new testing. And when you see the positivity go up, when it really should be coming down when you do more testing, you can see how hot this situation is and how serious the situation is.
So the money the money that came from workers' compensation. Tell us again exactly how that is going to help small businesses. I'm considering that they are losing a lot of revenue, those bars, with the 10 p.m. last call, especially here in Columbus, downtown Columbus, Short North area. They're really seeing a hit. And I've been seeing just my personal day to day, more and more places just closing their doors and not reopening, going out of business, unfortunately.
Well, unlike other states, we have not put a limit on the number of people in a bar or a restaurant. What we've said is, just like any other place, they have to be 6 feet apart. You can put 10 people at a table, but if they're together, but they've got to be 6 feet from somebody else. So we've not done what some states have done. We do have a 10 p.m. curfew. We think that that is the right thing to do and the safe thing to do. The $5 billion, I emphasize billion dollars, that we're sending out is from, at my request, from workers' compensation to every company in the state of Ohio that is part of the workers' compensation system. So this includes a lot of small businesses as well as mid-size and larger businesses. And it's an infusion of cash at a time when they desperately need that.
I do have a follow-up question to that because we have a viewer question, and she wants to know why this new relief promise to the small business owners doesn't include those small enough not to have the federal employer identification number or the federal tax ID number as well. Without federal assistance, what can we do for those, micro small businesses that do not have that?
Well, anybody who is part of the workers' compensation system, in other words, who pays into the system, you got to pay into it, and that's most small businesses, is eligible for this money. Every small business is also eligible for $10,000, which we took from the CARES Act dollars, again, to help them. We know small businesses have been hit very, very hard, and so that money is available as well. In addition, on top of that, is $2,500 for anybody who has a liquor license in the state of Ohio. So these are ways that we're trying to help. We know that small business has been hit hard. Look, when the pandemic hits, people pull back. And when we try to keep this virus from spreading and taking actions like closing bars or closing alcohol at 10 o'clock, we're trying to keep it from spreading, because when it spreads more, not only are we going to see more people get sick, more people go to the hospital, more people die, but we're also going to see people in the community pull back and not want to go out and spend money, not want to go out and because they're scared to go to a restaurant or to go to a bar. So keeping this virus down is very consistent with keeping people safe, and one depends upon the other.
Certainly a balancing act there. A question from a concerned parent talking about schools, especially in rural areas, going back to 5 days a week, full-time in the classroom. Is there ever a point, like a positivity percentage or anything like that, where you would direct the boards of health to intervene if you feel like different schools are putting teachers and students in unsafe positions as they push to go back to 5 days a week, perhaps at the beginning of the next semester in January?
Well, we could do that. I would do that if I felt, people's safety was in jeopardy. What we've seen, though, is that there's been very little spread directly in the classroom. Mm-hmm. The spread that we've seen in schools has come from kids bringing it in, but it's also come from, sometimes, just like adults, from kids doing stuff outside of school together with other students. But in the classroom, the teachers, superintendents, principals are doing a bang-up job. They're keeping masks on these kids. The kids are doing a great job at wearing the mask. And so we're not really seeing a lot of spread directly in the schools.
Are you worried about Thanksgiving? Do you think people are going to heed your advice? So What
Well,
what worries you about
sure.
that?
Sure, I'm very concerned about Thanksgiving. I was concerned about Halloween too. There's ways of doing things, and we don't have to give up our lives. We don't have to give up our relationship with our family and friends. We just got to be careful how we do things. And so when people gather, for Thanksgiving, wearing a mask is going to be important. If there are people who you're sitting around that turkey with who don't live in your household, even if they're friends, even if they're family, you need to be careful, because this virus is very sneaky. Sometimes we don't know that people have it, and they don't even know they have it, but they're carrying it. So being careful, being cautious will allow us to do Thanksgiving. It will allow us to, do many of the things that we like to do, but we got to be careful about it.
Now, you have a very large family. Have you and Mrs. DeWine decided what you're going to do yet?
Now, Fran's thinking about it, and what we've done in the past, is get together outside, and I don't know what the weather's going to be Thanksgiving, but this fall we've gotten together outside. We've kept families in their own units, the best that we could. People have worn masks. Everybody has had a mask on, and we've been careful with the food. We've been careful that it was basically food that, where you don't have a bunch of people dipping into the same place. So these are just kind of basic common sense things that we all have to kind of struggle with and figure out. But there are ways of making Thanksgiving, there are ways of making anything that we're doing a lot safer, and that's what we need to do.
I want to move on to the election right now. So Joe Biden took the podium last night, you probably saw, and said that the Americans would decide the election. On the other hand, the president has been tweeting all day, and he said, quote, they are working to make his lead disappear in different states, kind of declaring victory and asking for the votes to be stopped being counted, halted. What are we supposed to make of that? What are your thoughts on that and the president's tweets? I know you don't like to be asked that question about the president's tweets, but I feel like it is important.
Well, first of all, Ohioans did a great job. We count our ballots that night, with the exception of those that are mailed late, and they are in the mail, and there's 10-day period of time is what Ohio law says. But in a race that's not very close, like the presidential race, we're done. We know who won at least. So I wish other states would do that. But I think everyone who's looking at this presidential race, and we're all looking at it by the minute, by the hour, we all need to take a deep breath. We will elect a president. These ballots are going to get counted. Every presidential campaign that I've ever been aware of has lawyers in every state. And so if Joe Biden thinks that something's wrong, they can go to a court. If Donald Trump thinks something's wrong with how ballots are being counted, he can go to a court. We believe in the rule of law in this country. We have courts that will decide these things, and there will be a result. And as Americans, whatever that result is, whether we like it or don't like it, and basically about half of us aren't going to like it, whichever way it turns out, Americans accept it. That's what we do. We've done this for 200 years. We do it pretty well.
Do you think it's responsible for the president to use his huge platform to try and discredit what is happening as far as counting every ballot, and especially Pennsylvania?
The votes are still getting counted. They're going to continue to get counted. We just all need to sit back, watch it. It's going to happen. And if there's some irregularity, then each side has the opportunity to go into a courthouse, file an action. The courts will decide it if that's what has to happen. But we have a process in place. It works.
Any surprises for you last night as far as the statewide races, the U.S. congressional races, and there at the State House? What caught your eye last night?
Well, as the co-chair of the Donald Trump campaign, I was happy to see the president win. I thought he was going to win by about 4 points. That was what I told the president the last time he came in, and he did a lot better than that. So we're happy about that. But no, look, we ran a good election. I just want to thank not just Frank LaRose, the Secretary of State, but I also want to thank the boards of election in each of our counties and all the precinct workers who were out there yesterday, Democrat and Republicans. They did a great job.
All right, Governor, last question for you because we're running out of time here. Where do you see the numbers going? What are you being told by the experts? Obviously, we were still above 4,000 today, which was a little bit lower than yesterday's record-setting number. Thank goodness we didn't break that number again. Where are you seeing the numbers going, and do you think we're going to plateau or start heading downward anytime soon?
Well, I really don't know. This virus has a mind of its own. But what I can say is the odds are this is not going to lessen. The odds are it's going to continue to go up unless we stop doing some of the things that we're doing. I mean, if we continue to do the same things collectively, all of us, we're going to see these numbers keep going up. And ultimately, here's what's at stake. And here's why people need to wear a mask. Here's why we need to make good, conscious decisions about what we do. Having kids in schools at risk, having our hospitals overrun is a possibility. And the third thing is if we want our grandmother to be safe in a nursing home, you know, it depends on how much spread there is in the community. So keeping our schools open, keeping our nursing homes safe, keeping our hospitals open so they can get people in who have a heart attack or have cancer or whatever the problem is. These things are what's at risk by this virus running rampant.
All right, Governor, thank you so much for your time. We really appreciate it. And we'll see you at 2 o'clock tomorrow, I assume.
Okay.
All right.
2 tomorrow.
All right. Thanks, Governor.